Yes, friends, it's a Saturday, and I think everyone is doing good and great. Everyone is doing good and great. Today is a nice day, and we want just to go through the weeks, how the week has been, and what we have been doing through the week. It's called going through recap of the week. Yes, recap of the week, and I know many people here have been, the week has been good to you guys. The week has been good to you guys, and we thank God for everything. We thank God for everything. We thank God for what has happened. We thank God for gift of life. We say gift of life. Life is a gift. So we need to enjoy gifts of life from God. So this week we have done so many things, and so many people have learned. We have interacted. We have met some people. Although there is 2 days that I was not online. Oh, Jamaican uncle, welcome. Big up every time. Big up every time, and thanks a lot, uncle, for being there every time and interacting and showing us the way. And even having the heart of helping others. I was in a channel, and I was supporting some people, telling the people that my support is for free. If you hit me up, I'll hit your playlist and I'll see what you are doing. And the host was not okay with it, but I felt it's okay, because if you go to someone's channel, the rules are within the person. I said it's okay. I don't have a problem. I was just supporting your crew here, because if someone comes to my channel and someone else want to support that person, I should not feel bad. I felt it's okay, but for me it was just a wind along. So I just said it's okay. I'm sorry, I didn't know here you don't support each other like that, but I felt it's okay. So Jamaican uncle, thanks a lot for support and being there for me, and also supporting good people. The gift of the good heart. Not everyone has the gift of the good heart. Some people out here, but let me not talk about it so much. So the week has been great. The week has been so great, and I've achieved a lot in terms of interaction, knowing people, in terms of getting to understand some 1, 2, 3 things of here and there, and getting to understand how to interact with people. It helps a person to grow, because growth is the social well-being of everyone. Growth is the social well-being of everyone and the good being of people around. So appreciation is better. So today I just want to go through it and see how we were, what we did. This week we did something that is called headache, and we saw headache can be a symptom, or headache can come as a disease of its own. So it is very important when we do something, we talk about some issues, we do some things, and we interact as friends. And I usually say is any content creator that comes to my channel, and you have good content, I'm open. You can support any of my people. You can go to their channel, you can check out their work, you can interact with them openly. I don't have boundaries. Come to my channel, check out, interact with my people. They are good people, and support everyone. I know even Jamaican uncle does that, supports everyone with good heart. So the week has been good to my side, and everything we have done in a good way. We have interacted, we have learned some things that are very important. Very important. A headache is not just a headache. You saw there are some headaches that you really need to go to the hospital and also do some. And I think there are some people that were very confused. There are some people that were very confused about having a headache that leads a person to be given some oxygen. But we saw, those new things that come out, they're the ones which makes people to do what? They are the ones which make people to understand dimensions of life. They make people to appreciate the dimensions of life. They make people to know that these little things that come out of life, these little things that are seen, are not just little symptoms. A symptom is a sign of something. A symptom is a sign that something wrong is impending or something wrong is happening. So for me, when we started headaches, it was an easy thing because you've understood many people that go to a hospital and they say, I'm just having a headache that is not stopping. Or you go to a pharmacy and you say that, I've been just having a headache that is persistent, a headache that does not stop. And then you find that the doctors there have come up with a very funny diagnosis that you didn't even think of, a diagnosis that will save your life, So you my friends that are here and everyone that will watch, symptoms are not just symptoms. Symptoms are important things in life that should be taken care of when it is important time. You don't waste time and then you wait until there is a problem, then you start thinking you can do better. No, you should do what? You should at least check a doctor when the symptom starts and persists. We should get to know things that we do to avoid bad situations when symptoms come. It is important to avoid bad situations when symptoms arise. It's very important. So my people, my guys who are here watching, everyone who is here watching, the idea of going late when the symptom has persisted, it's not good. And that's why I've started with a very simple thing, a headache. Just a headache. And that topic, headache, you've seen it has come to be a very long topic that has come out to manifest in different ways. And even some people have started having some confusions about the headaches, confusions about the headaches, asking, so this one can be done like this one can be done like this, you see. So my guys, everyone who is watching, everyone who is here, let's get the idea, let's have it, let's help people out there, let's digest these ideas and keep them so that we can save some lives. And sometimes it's not even a matter of saving lives, it is a matter of saving some finances, because the more you keep a symptom, maybe the more inside you there is a bigger problem that is impending and that you may use a lot of finances to treat, you see. So headache, you have gone through several things in the capacity of a headache. We started by we talked about two types of headache. One, we talked about one, it was called what? Primary headache. And then we talked about secondary headache, the two categories of headaches. And then after we divided them into primary headaches and secondary headaches, you remember that primary headache is a disease like its own. Nothing is bringing it. It is like a disease of its own. But secondary headache is secondary to something. It is. Let me see this. It's asking me something. A bad habit you have. This one is giving this pop-up. Let me do this. It's not a good idea. Now let's continue and talk about it. We divided them. Secondary headache is that one that is brought because of something else. It is brought because of secondary to something, hypertension or a problem with your stomach or something else that is disturbing you that comes out with this problem. And then we started dividing now the primary headache. Now the headache that comes as a disease of its own, the headache that does not have any arisal, but it arises by itself. It just comes by itself. And we divided into 4 categories: migraine headache, tension type headache, and then we divided to cluster type headache, and we got to the one which is called trigeminal autonomic cephalgias. And people are telling me, hey, doc, that name it's a big name. Hey, please take us so slow. Trigeminal autonomic cephalgias. I said, trigeminal is the 5th cranial nerve. I explained what the 5th cranial nerve is. It comes from your head, and then it divides into 3. It helps you to eat, facial sensation, the maxillary, the mandibular, and the ophthalmic. And it can give you headaches, because when a nerve is inflamed, it produces substance P. Calcitonin gene-related peptide are produced. Calcitonin gene-related peptide are produced. These are the things that we talked about, and when they are produced, they are markers of inflammation. Your brain starts to have the inflammation, so you start having headaches. So trigeminal, the 5th cranial nerve, autonomic cephalgias. Cephalgias means a group of headaches. So it is just a word to say the nerve trigemina automatically giving you headaches. You see, very important to know. So we divided them into 4. So when it comes to the nerve, we said migraines and the trigeminal associated cephalgias, those ones are produced by nerves, but tension type is brought by muscles around the head, the skin, the tension, those ones. And that's how we divided them. I'm just going through what we did last week, which is important to understand, which is very important to understand. And as we understand these issues, we should get to know the risk factors. Why are we learning? Sometimes you should ask yourself a question. Why am I getting this information? Why am I getting this information? Is it because I want to be a doctor? Is it because I want to know more? And if I know more, what next? If I get to know more, what next? Those are the questions that we should be asking ourselves. But I said, you can help, you can save a life. You can know. Yours, Agnes Thomas. Greetings, Dr. Benjamin. Happy Saturday to you, Agnes Thomas, too. Hope you are doing good where you are. Hope you are doing good. Today I'm just getting a recap of this week, what has happened, what I've gone through the media here and there. So you see, I say that you can help yourself to save yourself from bad treatments out there, association with bad medics that don't reason well, to avoid mismanagement. Yeah? To avoid mismanagement. You can help someone else. You can save a life when you have some knowledge. And mismanagements at times are very expensive. If you go to a health facility and then you are mismanaged, you can use a lot of money to treat yourself. You see, so that's why we come here. We talk about these things. We talk about these things, and is this just a minute. So we talk about these things, and we kind of like sensitize. Jamaican uncle, blessings to you and your family. Thanks. And sensitization is very important. It's very important. You see now how we have talked about these things, and now some people are listening and they are taking care. They are getting their answers, why they have been going through this and why this is happening. Sometimes you take wrong medicine. The people that go over the counter, you go and take wrong medicine because this idea of people saying that I have you go to a hospital and you say I have what? I have migraines. You go to a hospital and you say I have migraines. It has been there since, every type of headache. But now, when we have gone through headaches, you understand that they are not just migraines. They are divided. That's why you have been taking painkillers, and this pain is not getting away. But now the sensitization, the talk that we have had here, has helped you to know that, I've not been having a headache that is migraine. I've been having something that is called cluster or tension time. And this is how I need to work on myself, to take care of myself. You see, this is the way we treat issues. Sensitization is good. So the week has been good. Migraines, we have talked about them. People have learned the difference between migraine and tension time, migraine and cluster headaches. And migraine, you've said, it is associated, and let me talk about it because it's the one that has always been talked about. Recurrent to moderate headache, always unilateral, often unilateral, worsening and thrombing, associated with nausea, vomiting, phonophobia, and phonophobia. Sometimes difficult to hear. This is a migraine. But it is divided into two. Migraine is divided into two. One, it is the first type of migraine without auras. Second, with auras. What are auras? Auras, associated things like vomiting, yes, sometimes loss of smell, photophobia. Those are auras. So migraine itself is divided into two, and you may confuse the migraine headache with something that is called, cluster headaches. You may confuse those two. So most of the cluster headaches, we say, they are sideways, around one eye, and temporal pain. It can last 3 hours. That is cluster headache. Associated with running nose, ptosis, eyes, or meiosis. All those. occurs in clusters of weeks or months. That's why it is called cluster headaches. It comes with clusters, time, specific time it arises. So those are the different types of headaches that we've talked about. Many questions came, many questions have come, but you saw the people that have been undergoing the headaches themselves were saying, yes, I'm undergoing this, and let's talk about the management. We talked about the management of these headaches, and the headaches were having several things. The headaches were having several things, like you take paracetamol and it's not working. You take brufen, it's not working. The NSAIDs, you take aspirin, nothing is working. Why? It's because the kind of the headache that you have, the primary type of headache that you have, requires something that is not a painkiller. It requires antidepressant, something that can depress the tension. Agonize is to increase the receptors of the chemical that makes you feel good, serotonin. You know, most of the antidepressants, what they do, they always just increase the receptors affiliation to those neurochemicals like serotonin. So when you get the serotonin goes more and comes to your system, what happens? You continuously feel good. You see, you feel nice. So that is how the treatment is. And if you are watching and you have any question, it's good you ask the question, my friends. It's good you ask the question. It's good to you yourself even add something if you know. Many people have been asking about when I started, is there any remedy of this? Is there any remedy of herbal medicine about headaches? Is there any remedy of herbal medicine about the, you know? So I said, I'm dealing with mostly conventional medicine, not really complementary or alternative. So I bank myself on conventional medicine because that is what I know more about. So for everyone who is here and you have a question, you can ask. But the week has been so good. Those are the things that we have done, of several things we have done about primary headaches, and we even introduced secondary headaches, but we did not go deep. The next week that we are going, as from Monday or tomorrow, we will be dealing with secondary headaches. Secondary headaches. But in primary headaches also, there are other primary headaches besides the three that we talked about, the four that we talked about. That are the primary stabbing headache, primary cough headache, primary exertional headache, primary headache associated with sexual activity, and hypnic headache. Hypnic headache. You know, those are others. So my take is, when you're having this, as you understand what is going on, you should check the red flags of the kind of headache, because what we have just started the primary headache, but the other ones that we have talked about is the primary is the one which we have gone so deep and talked about it. Consider a secondary cause if there is sudden thunderclap, and we say thunderclap is sudden painful headache that hits you. New headache after 50. New headache after 50. New headache after 50. When you have headaches that are recurrent, and you are over 50, you should be checked, because the more age goes up, the more issues arise. Fever, weight loss, or systemic illnesses. Fever, weight loss, or systemic illnesses, can of headaches, can be a cause of headaches. So you don't just assume you've been having fever and it goes, it comes, and you are okay. Neurological deficit. That means that when you have somewhere in your body non-functioning, numbness. Sometimes you have headache and you cannot put your hands up. You have headaches and your legs cannot move well. That is what is called nerve dysfunction. That is neurological. You cannot speak well. The balance is a problem. Sometimes you have a problem in balance and walking. Headaches triggered by valvular position changes. Problems. Progressive worsening. These are problems. Now, headaches may be considered in very many ways, and it may be showing something that is funny, like systemic symptoms, neurological signs, onset that is sudden, and older age above 50. Pattern changes can be something that can help you to do what? To check and see. So that is how we talk and we see about headaches that we have gone through, and we have seen that there are so many things when it comes to headaches that we have to check on. And let me check something that I wanted to discuss. Today is just a recap, and it's not a big thing. Just a minute, guys. There's something very important, a question that I was asked, which is important. Oxygen. Why do we give oxygen in cluster headaches? Someone asked that, and I wanted me to give a good answer. When oxygen given why is oxygen given? When oxygen is given, it has a very good function when it comes to cluster headaches, because the cerebrovascular vasoconstriction, the constriction of the blood vessels. During cluster headaches, blood vessels around the trigeminal nerve becomes dilated. When they become dilated, what happens? I'm looking at something here. What happens when it becomes dilated? During cluster headaches, blood vessels around the trigeminal nerve become dilated. Breathing 100% of oxygen causes vasoconstriction, a narrowing of dilated cerebrovascular vessels, which helps reduce the pain. You see, and there is something that is reduces activation of trigeminal nerve. Alicia Bausia is here. Hi Benjamin. Hi Alicia, you've gone for so long. Hope you are doing good. Now, it releases activation of trigeminal nerve, and when it releases the inflammatory neuropeptides. Welcome to the chat. I'm just talking about what has been going on through the week. So, calcitonin gene-related peptide, substance P, neurokinin A, those are things that are released. But now, when you give oxygen, these substances, what they do, they slow in release. They are slow in being released. They reduced or they are suppressed. So your vessels and the brain has little inflammation. These substances, like gene-related copeptide, substance P, and neurokinin A, they cause vasodilation, neurogenic inflammation, and severe pain. And severe pain in around your head, Oxygen decreases trigeminal nerve activation and reduces the release of pain-producing chemicals. You see, very important when you check it like that. It's very important when you check these things like that. Now, decrease parasympathetic activation. The oxygen, when you give someone oxygen in hospital and he's having headache, the first is to reduce these inflammatory neuropeptides. The second is parasympathetic activation. Cluster headaches belong to trigeminal autonomic cephalagias. The autonomic symptoms occur because of certain parasympathetic nervous system through the superior salivatory nucleus and sphenopalatine ganglion. You understand where the sphenopalatine ganglion is. And these symptoms include tearing, running nose, nasal congestion, red eyes, and eye swelling. The autonomic, let me repeat it, the automatic way of your body acting on something occurs because of activation of parasympathetic nervous system through the superior salivatory nucleus here. Superior, around here, it comes like this, and sphenopalatine ganglion. So you start tearing, having nasal congestion and running nose, eye swelling. And you know where I'm pointing is where the olfactory nerve comes. Oxygen suppresses this autonomic activation, reducing both pain and associated symptoms. Modulates hypothalamic activities. It modulates hypothalamic activities. The hypothalamus plays a role in cluster headaches. Attack occurs at the same time each day. Hypothalamus. And you remember what we talked about, the cadicadian rhythm. The cadicadian rhythm is a very important rhythm that helps you to rest and sometimes wake up. So if your cadicadian rhythm is bad, then you have a problem. You see, then you have a problem. So something I'm here looking at. Let me check this out. So that is it, my good friends that are watching. And we have said the week has been good and we have gone on well and everything has been so fine. So everyone who is watching this, the question that was asked is very important. It's a very important question, because why do you have oxygen when you have a headache, a severe headache? And you see it's bringing those. It modulates hypothalamic activities, decreases parasympathetic activation, reduces activation of trigeminal nerve, improves neuron metabolism. How is oxygen administered? It is given 100% effectiveness. 100%, imagine. And advantages of oxygen therapy. when someone has a headache like cluster headache or trigeminal cephalgias. Rapid onset, no sedative effect. There's no sedative effect. Safe for repeated use. No risk of medication overuse headaches. Minimal systemic adverse effect. Minimal systemic adverse effect. So these are the things that we have. That was the main question that I was asked, and it is very important when we are talking about headaches and these things concerning, it causes cerebral vasoconstriction. Cerebral vasoconstriction. It inhibits trigeminal nerve activation and reduces calcitonin gene-related peptide. Let me go about it and give the tips before I finish. Today is a short session because I'm having some work that I'm doing. It causes cerebral vasoconstriction, inhibits trigeminal nerve activation, it suppresses parasympathetic flow, it improves rapid relief within 10 to 15 minutes. That's it. So everyone who is watching and who is here, thanks so much for being here. I will cut this short. I'm going to do something, but I may come at 10 at night p.m. and we'll talk about it. So big up every time, big up everyone. Bye bye.